Cancer researcher, Dr. Pablo has spent years researching the research on cancer therapies. Many specialists are using one alternative therapy or another, when traditional therapies have failed. Vitamin B17 and vitamin C in high doses are common. Microphage activating factor, autoimmunotherapy is available, but not internationally. High pH therapy is exclusively available at Atlantis Health ReTreat. We combine the above and more when designing your personalized program. We then add hyperbaric oxygen, detoxing and relaxation massages, and a whole lot more. The best way to explain this program is 2 + 2 in this case equals 10 out of 10. We understand time is always of the essence, and have a philosophy to leave no stone unturned. Go to our website link below to learn more. Exclusively available at Atlantis Health ReTreat.
Good morning, good evening, good afternoon. Happy Sabbath. Hope you're having a wonderful day. Dr. Pablo here from Atlantis Health ReTreat, bringing you a special webinar that explains if you decide you would like to come to Atlantis, what is the procedure? How does that happen? So, quick, short, to the point video. If you've looked at the last 3 days of videos, they're all very important. And before these, there was a series of 1 to 5. Equally important to understand the different therapies, how they work, why they work, a little bit about why mainstream ignores these therapies, and how today I believe the therapies, the combination is so good that this should be done before chemo, radiation, or surgery. At least surgery, if they're giving you a really, really high chance of success, then this would be something that you would do is our home program to fill your body up with anti-tumoral products to give yourself the best chance of this thing not spreading when they cut you open. But it's always better to try this first. Recently we had somebody with ovarian tumor, was around 1 inch and completely disappeared in half the time that we expected it to. Due for a follow-up on her 6 months, but we expected to stay away. Cancer marker disappeared, the scan couldn't find anything, everything was normal. Her symptoms were terrible, like extremely bad pain, and completely disappeared. So, amen. God is good and amazing, and we thank Him for His guidance and to get the therapies correct, the right combination at the right time for the right people in the right place. So, what is the procedure if you come here? So after consultation, discussing you and your needs, and making sure that we see that we can help you. We believe that your core energy is strong enough to handle the travel, and you've got 3 to 6 months to live. Many people leave it to the last minute, and it's very hard to judge, and we don't always get it right. So finding out how much cancer you've got is very important. The amount of metastasis, the cancer markers, where they're at. Sometimes there's no cancer markers, which is frustrating. Sometimes you can feel the tumors. That's great, because we can take an accurate measurement and we can monitor it changing. Without that, we're relying on CT scans, PET scans, and X-rays. And so we do them as often as needed. We do blood tests weekly, of course, because we're hitting this cancer with everything that's available under one roof aggressively, and you don't feel any problem with that. It's comfortable for you, the patient or the client. We're working for you, helping you do the correct combination of alternative therapies that we've researched to be possibly beneficial for you, and we use them in a way that gives the best outcome. And if there was any way of improving it, we would certainly do it. So we've added a few new therapies in the last month, and I'll go over them in another webinar. So thanks for tuning in. Please like and share and spread this video around, because getting the information out is difficult. You know, Big Brother, as you've learned in the last 12 months, if they have a particular path or agenda, whatever it is, on whatever subject, they all talk the same thing, and they make you believe things that are not true. And a lot of people are waking up to that now. This has been happening for 20 years. For 20 years, I've worked in the alternative therapist industry, and they do everything to stop you from learning the truth about alternative therapies. And now some of you are waking up. So ring the number 877-891-1386. Register with the receptionist, and I will give you a call back in the afternoon. I'm booked out to 1 o'clock every day, but usually in the afternoon I'm free. Or go directly to the Contact Us page, and I'll click on that now so you can see it. The Contact Us page. You can come down here. It's got all the phone numbers, the details, and so on. And today I'm going to cover what's involved coming here. What happens? How does that work? And so here you click on here, and you can book any time slot. You want a quick 15-minute chat, you'd like to follow up on your home program, or you'd like a 60-minute consultation, or you want to get your whole family, 5-10 different people all on the phone line asking questions at the same time. It's great. I like that. You all got one negative person in the family, and it's okay. They're scared, they're worried about you, and they want questions answered. I'm willing to talk to anybody, the people who are for it, the people who are against it, medical people, anybody. 20 years in doing this, I've spoken to a lot. And the bottom line is the traditional system is failing. It's a money-making machine. Although you get a lot of the therapies for free, the bottom line is people are spending $1, $2, $3, $4, $500,000, $500,000 through their insurance on doing therapies that cannot work and don't work. And 0.03% success rate. If you've done nothing, you would live longer, have a quality of life, and possibly become cancer-free just by changing diet and eating properly. So choosing a nutritional path, what does that involve? It involves something quite simple, a changing your diet. And you don't have to do this aggressively. Some people do. It's got to be done that you want to do it. Your body is so intelligent. I can't stress enough the power of belief. The power of belief, having unquestionable belief in what you're doing, is so important. So you need to search, research, and get an understanding so you don't have any question. How do I make this very clear? You know how hard the people work to win an Olympic gold medal? They work really hard, determined, sacrifice, put in all their energy, all their mind, and you cannot have somebody sitting there saying, you're going to fail, you're a loser. You can't make that jump. It's impossible. Nobody's done it before, and you're not going to do it. You need the attitude that's going to say, yes, I can do it. I will win. Nothing will stop me. Eliminate all negativity. Get them out of your life by just telling them, no, you're wrong. I'm going to win this. This is the path I'm going. I'm choosing. It's my body, and I'm going to win. And that's what it takes to win a gold medal. Unquestionable belief. No doubt. Complete, unquestionable, from a cellular level, your soul has to believe. And from that level, I'll fight the same, because I believe you can become cancer-free as long as you believe you can become cancer-free. Eliminate the doubt, get the right combination of therapies, and it doesn't matter. As it says in the Bible, we can build mountains together. We can do anything that we believe. It's possible. But it does take unquestionable belief. So after we have a consultation, you fill in the form, we set up a time. The first time, usually I chat to you for 5 or 10 minutes. It's like a hello, how are you? This is who I am. This is who you are. This is what you've got. I'll send you a form to fill in. It's questions to make me know who you are, to understand your body. Where are you at? What other problems have you got? How can I make you understand why I need that? Most people, it's probably logical, but why do I need to know that you've got a broken leg, or that you've got one leg, or that you've got heart disease, or that you've got sugar diabetes? All these affect the path of your treatment. All these affect the difficultiness of getting you from here to a machine that can win the gold medal. Every single step we take is calculated based on everything that we know about you. And usually in the first few weeks of being here, I learn more things just by sitting with you 4 or 5 hours a day while you're having IV, questioning you. I find things that are critically important that you didn't mention that will affect the path that we take to get you well. And so you can only do so much on paper, and then when you're sitting down with me, you go, I forgot all about that. I forgot that when I was young, I done this. So those things come out over time. And it's not an interrogation, it's a relaxed chat about your past, the good times, the bad times, and things that have happened. Some of that's to get your mindset straight, to be strong, to be unquestionably believing in what you're doing and what your path is, to eliminate stress, which is caused by what? If you watch my last video, lack of knowledge, not knowing the solution to a problem. It's so important to have no stress. And so once we get you here, you're wrapped in our arms, we care about you, we make sure everything is as comfortable as we can, we do everything we can do to make you not have any uncomfortableness. We have somebody go shopping with you. If you've got somebody with you, we teach them, show them where the shopping centers are. Everything's so safe where we are. We're in South America, if you didn't know, and it's a big country, so we're in a nice, quiet corner. That is completely safe, a 5-hour flight from Florida or anywhere on the south coast of the USA. My Australian friends, it's a long flight. You're looking at around 22 hours, plus any stopovers. And as long as you avoid New Zealand, it's in that direction, straight across till you hit the mainland. That's where we are. And you've got 2 flights. You've got a flight to Chile, and then you've got a flight to us. England, usually, sometimes the flights fly into the US. If you don't have a passport, that's a problem. So the next best thing is the flights go to anywhere on the eastern coast of South America, and often Mexico. So you have a flight to Mexico and or Colombia. They're beautiful big international airports, and then to us. We're located in Ecuador on the coast in a place called Salinas. Chipipe, Chipipe. So you can search Salinas space Chipipe, Chipipe, and you'll see the beautiful location. And we're in Puerto Pacifico, right at the end, the last building before the army camp. And it's a very safe, beautiful location. And it's a well-known tourist retirement place for people from the USA. And so it's an easy flight, and people enjoy the flight, don't have any problems. We meet you at the airport. Usually the flights either arrive between 12 and 3 a.m. or p.m. So whatever you book, if you fly American Airlines, you usually arrive in the daytime. Otherwise, you will arrive usually late at night. Either way, we're there for you. Somebody will be there. Most patients I meet. So that's a long night for me. I'm up until, if your flight's scheduled to land at 12 o'clock, and it's by the time you get your baggage, it can take up to an hour, I guess. And so it's a late night for us, but we think that it's important that we have that level of care for you, that you're not left alone at any time. We take you to a beautiful hotel that's got a beautiful buffet that's a kilometer long, that you can choose the food that you like for breakfast. We stay there 1 or 2 nights. If you're having a port fitted, which is a minor surgical procedure so that we can give you high levels of concentrated IV. If you have, for example, vitamin C in the vein, you can only safely have 30 grams per hour. If we're giving 50 to 100 grams, you can't put it in the vein. It needs to go in through a port so that no veins are damaged. So some of the products we use are concentrated, and so a port is a safe way of delivering them. If you're choosing not to do alternatives and you're going down the path of chemotherapy, and the chemotherapy is not tablets, if it's IV, ask for a port. It's the best way to not damage your veins and give you the best chance after, God willing, that you're cancer free if you choose that path, that you do not have damaged veins, because one of the biggest problems with people is damaged veins. The next thing people make a mistake of is they have the port removed after they finish the chemo, when they're told, we think you're in remission, we think you're cancer-free. The port can stay in for 10 years. It's safe. Can stay in for 10 years. Don't have it removed. Wait the 5 years to make sure the cancer doesn't come back and then take it out. Because to have it fitted again is difficult and possibly a problem. It's much safer to leave it in there. It's not a problem. Once a year you have it flushed. Your local physician or anyone who knows how to use a needle it's under your skin. You just push in and squirt 15 ml of saline in it to flush it. With one ml of heparin, and that'll keep it completely free of any blood clots and make it workable. If you do what we recommend, and that is you come back for IV therapies every year on the anniversary of becoming cancer-free, you don't have to have a port, and we can give you really strong. We pretend that you still have cancer, and we give you the therapies, none of them that cause any sickness or any unwellness, but we give you very strong therapies to kill any cells that might be thinking of coming back, to keep it away. It's part of our guarantee. You get free 2 weeks of therapies every year after you're cancer-free, included in our program. And we do have a lot of people take up that option. They don't always come every year, especially from Australia. They sometimes come every 2 or 3 years, but it's an amazing offer. Why? Because we love your testimonials. We love to keep you as part of our family. When you lived with us for 2 or 3 months to get rid of this thing, we're close, we're friends, we're family, and we care about you and want you to stay cancer-free. As we move to our bigger facility, which will be this year, will be next year, because this year's just gone past with so many complications and ups and downs in the world, that it's delayed things on our part. So it will be next year before our facilities open, but in that place you'll be on a beautiful lake overlooking with animals, nature. So we're moving from an ocean location, only not far from here, but you'll be on a lake that's kilometers wide, and ducks, swans, animals, nature, beautiful. So it's been 20 years hard work to get to that, but we are very, very close to laying the new foundations in a new place. The last place that we started to build in the lockdown, there became some complications, and that's subject to legal action, which we believe will win. Okay, so we've picked you up at the airport. You've had a nice night rest, and then we take you to the hospital, which is a beautiful hospital. There's a few in the local area that are top end, high end hospitals, and they have all the modern technology and a great surgeon that we've used now for many years. He will meet you. You have a COVID test first thing, and they do blood tests. Then you come back, you relax in your apartment for a few hours. They call when you're ready, so you're not sitting uncomfortable in the hospital. About 2 hours before the surgery, they take you inside so they know 100% you didn't eat anything. And then you have this 25-minute procedure, and you're taken out to an area to relax for an hour in recovery. And then we pick you up. We either take you back to the hotel, as long as you're feeling good and you're well, which usually everybody is. Sometimes if it's late, we'll stay in the hotel another night and leave in the morning. Have a big breakfast and leave in the morning. Pre-surgery, 5 hours before the surgery, there's no eating. So if you're scheduled for surgery at 2 or 3 in the afternoon, you can have breakfast. After your blood test, you can have breakfast, a light breakfast and some liquids for a couple of hours, and then you're fasting till the surgery. So we've never had complications with that, so that's pretty straightforward and simple. Then you arrive at the spa. So what happens when you arrive at the spa? Usually you're there Thursday or Friday, late afternoon, and we prefer it when you arrive in the daytime because you got to see the drive and enjoy the drive. If you came straight after the surgery, people usually will eat and then they'll sleep, and they'll wake up and they're on the beach and they don't know about the trip. And that's fine. We take you up to your apartment, we show you everything, settle you in. Your apartment is already full of food to prepare, juices, everything's in the apartment for your first 3 or 4 days to get you started. If there's anything you want, it's a phone call and somebody will go and buy it and bring it for you. So if there's something that we overlooked, we ask you for a list of things that you would like in the apartment, and we throw in a whole lot more. Fruit, apples, vegetables, salads, everything. And what happens the next day is usually on the Saturday we have what we call induction. That's where you and whoever came with you comes downstairs, and there may be 2 or 3 or 4, maximum 5 people with cancer and their families. So depending on the number, how we set it up in the spa. And we have what we call induction, where we go over the rules. Now, if we have 4 or 5 families, we will have a tour of the spa. We will show you all the different sections. Then we'll take you somewhere for lunch, and we'll actually do induction out on a big table, because if you brought 2 or 3 members of your family and there's 5, that's 15 people. We would not fit enough comfortable chairs for everybody in one room. But usually there's only 2 or 3 people with their partner, and they fit very comfortably, and we give a tour of the facility, and we have all of the staff introduce themselves, and that's induction. We go over the rules of safety. How do we keep, we've never had anybody have any problems here. Why? Because we have a set of rules, and if you follow the rules, you don't have any problems. So for the first week, we like you to go with our staff wherever you go, anywhere, until you're confident and you know where everything is. We give you a sheet of paper with where the local shopping centers are, their names and everything. If you want, let's say you want to have Chinese food delivered, we can have that delivered to your house or to your apartment, what we call your temporary home. Anything you need, we can get delivered. We have cleaners, we have cooks available, but we have made a conscious choice this year to have everyone cook for themselves, because it's too complicated and people have their own style, and depending on how long you've been on the journey of cancer, you have your own beliefs, and those beliefs are important because that's what got you this far. We don't want to change them, and we don't want to tell you that you have to juice, or you have to do coffee enemas, or you have to do this. People who have come from places that have been doing that and that are really skinny, they're the only ones I have a strong word to, that they have to put on weight. They have to be strong. So your first week and then week off is to put on weight and get strong, because you will not survive the journey to become cancer free if you've got no muscles left. And it's important, and it's really sad. People come to us from Mexico, there's nothing left of them. If you really believe that doing 100% juicing is going to cure you, then don't come to us. I taught the Gerson program many years ago. I read the books changed now. He never cured an O blood type, and the reason he claimed his cures were successful was because it killed parasites in the body. There are other ways to kill parasites in the body. Coffee enemas are great if your liver function is really weak. It does help build up the liver strength. We have colonic machine, and we can do all of those things, no problem. But do I recommend that you do coffee enemas every 3 hours and juicing only and lose all your weight and all your muscles, especially O blood type? O blood type need meat. You cannot be 100% vegetarian unless you've evolved and been doing that for a long time before you become unwell. So please avoid some of these trends. I do think they're dangerous. Why? I have people coming to my clinic that I can't even find a muscle in their buttocks to give them a B12 injection. There's no muscle left. They're just floppy skin and bone. And you don't want to get like that if you have cancer. You need your core strength. Well, it's one person, we spent 3 months giving them 2 pizzas a day plus the 3 meals a day to get him strong enough to be able to do things, because he was just so weak when he arrived. So I'm a little bit different, and I believe that I'll put myself up against any other person doing this work, because I'm very confident we have an amazing combination. That if you have your core energy, you follow everything 100%. If you have problems, you talk to us and let us know early, very clear that you're having a problem in a particular area. Don't keep secrets. You will have the best outcomes you can have, and that's very, very important. So after induction, you go home, relax, but what we often do is we'll have lunch with you on the Saturday, let you rest completely on the Sunday. Now, normally we have one of our staff members sleep in the apartment for the first few days, just to become friendly with you and to take you out if you want to go for walks or drives, just to show you how comfortable and safe it is here. People have a paranoia about traveling to South America. Well, I can assure you we're here because it's completely safe. and never had issues at all, never had violence, never had anyone have any problems at all. And so we like to keep it that way. We have terrible stories from Mexico, and I think you all know that Mexico has a lot of street crime and shootings, and that it doesn't happen where we are. We're in Ecuador on the south, on the coast, on the ocean, and it's beautiful, safe. We're in Wales. We're just ending the whale season, so the clients went and saw whales last week. On their week off, they went for a whale trip, which was absolutely mind-blowingly amazing for them. And so we try to, if the person's well enough and comfortable. I've got a cat, obviously, that's looking for a door to be open. We've got 5 cats and a bull mastiff dog who's outside chewing bones. It's 7:30 and they just got fed, so they're looking for help to get outside, I think, as they're running around. There you go, they're out now. Okay, so you're comfortable, you're in your apartment's got everything that you've asked for and everything that we think you need. And then on the Monday, your program starts. So Monday morning, we do blood tests. If we didn't get them done on the Friday or Saturday, we will get a full screening. The full screening is everything that you never thought was possible. We do a lot of blood tests in the beginning to find out everything about you everything that you know about is not a problem because you've told us, but everything you didn't know about is important. So we're searching for things that you didn't know and we didn't know, and hopefully we don't find any, but if we do, it's good because it's a reason why you may have a hiccup on your journey. And if we manage to eliminate that through the first week and a half, 2 weeks of nutritional therapies, it does increase your outcome, your chance of having success. We also do a lot of ultrasounds to check your cancers and your liver function, kidney function, bladder, your pancreas, and so on. So we will, if we do see something in the first one, we will do that on a regular basis so we can see if it's changing, getting bigger, getting smaller, or gone, if it's inflammation or whatever. This fibroid that we had, this lady I spoke about earlier, on her ovaries, completely disappeared, and so that was good to be able to see it and see it changing. Gives confidence when you can see changing. Not that I like any cancer, but if there's going to be a cancer, I like it when you can feel them and they're sticking out, and you can watch them shrink. It's just so beneficial and exciting to see them disappearing. So okay, so we've got the blood test done and we start doing GSMAF, B17. This is the cancer program. GSMAF and B17. On the first day, you'll have more than, so all other places give you 0.2 mil of GCMAF. Let me tell you, doing live blood analysis and testing how it looks after you give 0.02, it takes weeks to get your levels up that your macrophages they're wide awake and they're active and they're chasing the tumors and fighting really hard. So everyone understands that you have nagalase chemical, the chemical called nagalase being given off by your cancer that puts your macrophage to sleep. One of the reasons your body doesn't attack the cancer is because the cancer is putting off this chemical called nagalase. So if you've got a lot of tumors, 0.2 mil of GCMAF is not going to be enough to overcome the chemical of nagalase. That's a lot from a lot of different tumors. It's not enough to overcome it and get rid of it. Excuse me, Melissa? Are you here, Melissa? Maybe they're not here, I thought. Yeah, could you please close that door? Because Bailey's is chewing bones. And it's very, very loud. I don't know if the people at home can feel it, but I can feel it. He's got a big bone. We gave him that so he wouldn't come up and keep asking me to take him for a walk. Thank you, Melissa. So doing the ultrasound is very, very important. The blood test, and so what we're looking for is anything that's out, and so we can use that as a marker. It affects everyone as an individual, so and anything that's out, from your thyroid, your cancer markers, yeah, anemic. People often will arrive here, they're anemic if they've been to another place and facility. So we'll do everything to correct that. And while you're here, you shouldn't have those symptoms, God willing, because we're doing things to stop you becoming anemic, because it's common for people with cancer. 50% of all the blood that's collected is for people with cancer. It's common for people with cancer to become anemic. And so we do things that in your drinks that you have, in the IVs that you have, to strengthen your body, to stop it becoming anemic, and to keep your protein levels high so you don't have fluid problems and so on. The things that you often see people die of are completely avoidable, but you have to be very proactive so you don't have those symptoms. So you do Monday, Wednesday, and Friday, you'll be doing up to 8 hours of therapies. So you've got the morning IVs, you've got lunch, and then you've got afternoon therapies. Tuesday and Thursday, you're only doing IVs and anything that you missed the day before. So if you manage to not get hyperbaric because you spent longer on lunch than you should have, or whatever reason, you can catch up on the things that you missed the next day after you do your IV. 1 week, then a week rest. The week rest, we're only doing GSMAF injections, checking your bloods, and anything you want. So you can say, listen, I really love that hyperbaric. I feel a good benefit. It increases my sleep. I sleep so good. It takes away my pain. So you can have anything you want included. So we just book you in. You just go up to the girls and say, I want to do hyperbaric every day this week at this time, and that's yours. There's a gym facility, so you can do any exercise. You can't go in the swimming pool except for your legs, because you have a port on, and because we're accessing the port's under your skin, but because we're accessing it with one needle once a week, every 7 days we take that out, give it a day's rest, and put another needle in it. So that you cannot, even though it's covered and it's a waterproof cover, the only risk for you not completing your therapies is to damage that area or to get an infection. So we can't have you swimming as a result of that. However, we are on the ocean and people do like to earth out, and we do think that that's important, to take your shoes and socks off, walk on the sand, put your feet in the salt water, and enjoy a comfortable walk on the beach. The weather, now we're just ending the winter and we're coming into the summer. This video is done on October the 9th. It's currently 7:30 p.m. So October, November, December, as the US turns to freezing cold, we warm up. So we never get cold here, but we get warmer. But on the coast, it's not humid, it's comfortable, and it's clean air. We're actually on a point, how can I say it? We're on a V, like an island coming out from the coast. And so we have wind and breezes coming from the open sea. So it's very clean and healthy air. In fact, people with lung cancer love it here. They arrive and they just can't believe after 1 or 2 days how they can breathe easier here, because the air is so pure and clean. Yeah, I do have that on. I thought maybe I left the microphone off. Okay, so in that week, so we've had a week of IV and a week rest. In that 14 days, I got to know a lot about you. I got to know the ins and the outs and the things you knew, the things you didn't know. And so after that week rest, the very intensive program starts, 14 days. 10 days of a particular product that causes cancer to shrink very, very, very quickly. It's called high pH cesium therapy. It's a combination of more than 20 minerals, and I talked about it in other ones, but you'll be doing that. You'll be doing vitamin B17, which you already started from the day you arrived. You're doing GSMAF, which you already started from the day you arrived. You're doing it orally, you're doing it as a nebulizer, you're doing it in injections in the local areas, you're doing it in the vein, you're doing it in every possible way we can give it to you to get it as close as possible to the tumors. After that first week, when you come back the second 2 weeks, we target the most dangerous areas. So let's say you have cancer in the spine and you're likely to become a paraplegic. We put all of our effort to eliminate that bone cancer in your spine first. Doesn't mean the others aren't going, and definitely they will not grow while we're doing this. But getting rid of that spine cancer is a priority. If your liver has a problem near the bile duct, it's a priority. We put all the effort in the liver and so on. So as long as we know where the tumors are, we put an extra focus in those areas. So the other therapies may or should be working on them, But when we inject with G7EF into the local area where the tumor is, right around it, we can feel the tumor and we get as close as we can to the tumor. We get the best outcomes and the best results from doing that. Like amazing, you can feel changes, especially in breast cancer. Breast lumps you can feel them changing from large tumors to small tumors within 14 days of doing this IV program. It's amazing. And that's your routine. And then a week off, 2 weeks, week off, 2 weeks. In the last 2 weeks, we'll do a scan again. So we've done a scan, which I didn't mention earlier. We do a full body scan. If you didn't have it done before you came, we do it the day you arrive or the day after. And we go to the same place, the same time, the same routine, and do it again. And that's important. And then we have a comparison of exactly the same machine to know that, yep, definitely it's not because of a different machine, it's not showing up, it's the same machine. We will see the same things, and God willing, the cancer's gone, or there's a little left in an area, and we can put all of our energy into focusing on what's left. And that's it. Pretty straightforward. When you go to the hospital, naturally there's the port fee. You've given us that. We let you know the prices when you arrive. Our staff take care of that. That process is paid for. You've prepaid before you come here usually, or you're organizing that payment immediately, because we can't start any therapies, and we have products flown in from 3 continents. So we need payment before you get here to make sure that we have all of the product for your full 3 months. Otherwise, it's scripted for you, can only be used for you. The formula's put together for the type of cancer you've got, and that's flown in. So that's one of our biggest expenses, is flying things in from England, from Japan, and from Australia. There is one therapy that we get from, I think it's Russia, but I haven't been using that for a long time, the blue scorpion venom. We've been getting results without it. So if we had anybody where we were not getting results, we have other therapies we'll organize for them, and they can take those home and continue to do them, to try something different, because to try the same thing when it didn't work is just stupid. It's the equivalent of insanity. If something's working, you need to keep doing more of it to get rid of it. If it's not working, then you need to look at doing a different style of therapy. So there are oxidation therapies, which are very good. You can do them orally. So there's a combination of things that you can do safely to get rid of cancers that are the opposite, complete opposite of what we're getting the highest success with. So we do this, but if they're not working, there is another path we can go down. And so in this last 3rd week, we know usually in 6 weeks, there's major changes in your blood markers, the way you feel, the way you look, and the way the tumors feel. We can usually tell at the 6-week mark how things are going. And that's it. You can opt to stay an extra month, and that's a fee of $7,750 to stay per 3-week cycle. So it's 2 weeks, week off, 2 weeks, week off. So that 3 weeks is a cycle, and it's $7,750. If you stay a little bit longer than that till your flight, there's no additional price. So it's just a flat $7,750, which if you're only doing one cycle of the 2 weeks, so it's the week off, then 2 weeks, you still have that other week to pack and go home. We've had people stay an extra month or two, 50-50. Some of them, the cancers were big and they got down to a little tiny size, and we said the best thing is to do surgery. And the cheapest way and the only way to get it done quickly is to do it here. And so we have brilliant surgeons that can do things tomorrow, 9 times out of 10, definitely within the week of us requesting. And we pay a little extra for extra fast service, but these are really high quality doctors, and they simply, they're working later than normal, and they will do it for us because they're friends, what we call friends of the program. So if you had a small lump left, we could have that removed and then get you back and do some IV for a week just to make sure that there's no metastasis or any cells that manage to get out. So we do it right up to the day of surgery. You have the surgery, and then for the week after, and when we get the estimated cost, and it's hard because they're hospitals, if you have complications, the prices can be very different. But we had a lady come here who had her breasts removed, and that was under 20,000. Big money, but if you're doing it in the US, it's like 80 to 180,000. Small surgeries, we've had around 5 to 7,750. If you're in and out quickly, it's much lower. If it requires a week recovery in the hospital, that adds a lot of price to the treatment. And we can only get an estimate. We cannot get an accurate price on that. So we can give you the out-of-pockets that we expect, that we know, and the price of the surgery, we get a reasonably good estimate of that. But the recovery time, they might say, oh, you may need 5 days. Most people that have been on our program, they recover really quickly because they're so nutritionally strong. Their body's just a fighting machine and ready for it. But if you're very weak, it's a different story, and it'll take a while to recover. So that's my recommendation. If there is any cancer left, is to have a surgery and have it now, because if you go home, it's going to take a while to get in, and all that time is lost time. And if this thing decides to bounce back aggressively, that's a big problem. So to get rid of it while you can is what I would recommend. And these are all unknowns. You're talking unknowns. We're believing that's the only cancer you got left, and as long as they're right and they take that out, they get a very clear margin. They do all the checks. I have a policy: if in doubt, take it out. I tell the surgeon, if there's any doubt, if you think, oh, that might be a little off color, just take it out. These people don't want to fight, the tumors anymore. They want it out. So have a very clear margin. Don't be concerned if you're taking an extra 2 or 3 inches of colon out, or a little bit extra breast tissue. The person wants the cancer gone, and that's the way to tackle it. So that's my summary. If you come here, I think I covered almost everything. What's my timing? 41 minutes. Done well today, keeping it under an hour. So the bottom line is, ask a lot of questions. We'll give you all the answers. Bring somebody who you care, who's a supporting person, that's on your side with you. Somebody who you like their cooking, and let them look after you. And the fear of traveling, once people are here, they don't want to go home because there's more trouble at home than here, that's for sure. We're in paradise here. There's no problems with lockdowns anymore. There's nothing. Masks are still worn in some locations, although I think they cause more problems than the benefit. We won't get into that, but if you understand biology, you understand funguses, it's a big problem. I get this cough only from wearing masks. It's a subject on its own, and it's not for this video. I won't get political. So that's basically all the questions. Payment is done. I've had a few people recently ask me, do we accept crypto? Yes, we'll accept Shiba coin. Shiba's a Bitcoin, Ethereum, and Shiba Inu. And we prefer Shiba Inu out of any of the coins. We will certainly accept that for your rental deposit, because a lot of people like to be paid in Bitcoin these days. It's becoming a way of payment. The rest is in US dollars. When you come here, the money's US, which is great. There's no confusion. If you go to Mexico, they're in a completely different. You have to calculate every time you're doing something, and it's easy to get diddled, to pay somebody extra that you didn't know. Here, a taxi to the shopping center is $3. At home it's minimum $30 most likely if you're using a taxi. So here the taxis are $3 and $1.50 to some locations, but usually from your apartment to the big shopping center, which is the same as at home. Your big shopping center that's got a movie theater, got a big food court, got all the shops, and it's got your place to do your shopping for your groceries. That's $3. There's one halfway, which is $2. It's called Super Maxi. Supermaxi has more imported products, more expensive products. So a lot of people like to go to Supermaxi once a week and the big shopping center once a week, alternating 3 or 4 days. If they're buying certain things like fruit and veggies, they like to buy them on a regular basis, so they're always fresh. The common thing we get here, so one problem, so let's talk about problems. Everything's in Spanish. So, you're in a different country. So when you're shopping, it's good to have somebody with you, one of our staff, to help you find the things you need. And we've got people that have been in the US that will accompany you. We pay to accompany you, that know what you're looking for. So you need that particular, for example, not recommending peanut butter, they'll find it for you. If you want that particular salsa or sauce, we call sauce in Australia, you call salsa. If you're looking for that particular jelly, which we call jam, they call it something different here, I'm sure. I'm working with people from England, from Ireland, from US, from Canada. We have a lot of people from Canada come here, from Australia, from New Zealand, and I'm consulting all afternoon with people of English. So my native tongue to Australia is completely gone, and my children don't recognize my voice when I call them. They say, "Who is this?" And it changes from month to month depending on the clients we have here. So when you're sitting down talking to an Irish person, I'm going to try to put on that accent, but it's very, very different. And my England friends certainly caused my voice to change when they were here. And so anyway, that's got nothing to do with anything. So I think I covered all the important things. We negotiate a price. You don't have any out of pockets. So there's no, when you come here, you're buying your own food, which is economical. If you go to the market, you can buy bags full of groceries for a few dollars, like brand, fresh, organic. They don't have money for chemicals here, so they're all small farmers. When you go to the main groceries, I'm not so sure, but when you go to the little markets, the veggies and fruit are very cheap. They look scarred and different. Oranges are got a green tinge on the skin because it's sun here 24/7 all year round, and so they have a green tinge to them, but they're quite ripe. So bananas taste different than you've ever tasted bananas before. The pineapples are to die for. They're not acid, and they're almost sweet and beautiful, the flavor of pineapple, which is really, really got some really important enzymes for you. Every meal should have a little bit of pineapple in it. So all the fruits here are beautiful. We have an expensive twin auger magnetized juicer that if you want juices, the staff will make juices for you. Because of difficulties in the past, we let you choose the juices, bring them down, and the staff will juice them for you. We've had 6 different cultures here all at once. Ecuador's not high on spice, but if you come from India, you like a lot of spice, and you just don't like the food without it. If you're from England, you have a certain way you like food to be presented. If you're from Australia, put it on the plate, make sure it's fresh and edible, and we'll eat it. We like our meat tender. All of these things are an individual thing, and the way you cook them and to prepare them is individual. So we just chose that it's too difficult. We had 3 full-time, fully qualified chefs from 3 different continents, and we still had difficulty making people happy with the food. And it's not a result of the freshness of the produce. It's just the cultures are so different, and so we've made a choice to let people look after their own food. Unless you need help, we have chefs available that will do cooking for you in the house or bring to your house. And we have some lovely restaurants that we can call and have delivered anything you want, and it arrives nice. We also have a member of staff, a contractor, not full-time staff, that will go and buy from a restaurant, come to your house, present it nicely on a plate and give it to you, warm it up if it needs to be warmed up. So we have everything in place to make sure whatever you need, we can make it work for you. Like I said, we take payment. We will take cryptocurrencies, 3 of them. Shiba, SHIBA, Inu. So let me just check that here. I've got a page open. So we'll take Shiba Inu as a payment. We will take US dollars, and that's it. And payments are made into two different accounts, and so on. So that's straightforward. Once you get to that, we send you the details. You choose the way you want to transfer it, and what we like about crypto is you send it and it's 5 minutes, it's there. When you do a money transfer, if you do a money order arrives at the latest the next day. If you do a money transfer, so money order is done in the bank. If you do a money transfer from your account, depending on the system that they use, it can be 1 day to 7 days. If there's a problem, that 7 days starts again. So we do need payment to be made before you get here, because we do not want to delay your treatment program. When you book in, we pre-book your apartment. So let me go down to here, we can click on this one. We do pre-book your apartment. So there's over 100 pages on the website, so everything's there for you to find. Your apartments are very, very nice. So we do pre-book your apartment, and we prepay it for the 3 months. So that's the beach we're on. It's beautiful, yes? So let me get rid of that so you can see me fully. Okay, that's as big as I can get it. So no, it's not working. Okay, so you can see that on the website anyway. It's the link, Atlantis-health-retreat.com accommodation. So you're right on the beach where you're seeing that photo is taken from one of the apartments that we use. And that's an apartment we have used in the past. They're beautiful. There's 2 buildings, both built by the same builder. One's 6 years old and one's brand new. So these are actually shots of the brand new one. There's a gym facilities, and so on, like I mentioned earlier. Everything's pretty, down the bottom here you see all of the therapies that we have. The new one is the biomodulation therapy, and I haven't done the web page on the other one, so I'll update that soon. Clearly you can find all the cancer therapies here, and this is only half of them. Half we do not publish on the site, because whether we use them or not on your cancer will depend. So we do not, these ones that we have here we can use on every single type of cancer, but if you some of the other therapies that we use are different, so they're only good for specific types of cancer. So in the bottom of the page you see there's a lot of information on individual cancers, and those pages explain how we may do something different. For example, if you've got a breast cancer and we're doing high pH therapy, the high pH therapy is designed to take the pH of the cancer up so high that it can no longer ferment sugar anymore. What advantage have we got if you've got breast cancer is we can cup it, so we can get a bowl and put your breast in a bowl and get you to lay backwards, and the whole breast has got the high pH therapy in it, raising the pH of that breast so high that the tumor dies and shrinks so quickly. And so sometimes we do that in the clinic. Sometimes we say, after we show you in the clinic how to do it, we get you to do it for a particular amount of time at home, in addition to the IVs, and you can do that every day. And as a result of that, it can cause the cancers to shrink much quicker. Yeah, what other ones? information overload. No, let me go back. This one had some cancers: lung cancer, bone cancer. Our highest success rate is bone cancer. It goes so quickly. Thank goodness. Bone cancer and bone cancer. Most people who come here have got metastasized cancer, so cancer's trying to survive, and its goal is to spread as much as it can through your body. So taking certain nutritional products like tracheal cartilage helps. Even an aspirin, believe it or not, taking a baby aspirin can stop your cancer from spreading. And as long as you don't have a blood thinning problem or any stints, a baby aspirin is very safe. Tracheal cartilage is amazingly good to add at the same time. It doesn't thin your blood, but it stops the cancer being able to format a new vein to start in a new location. The website's pretty to the point and blunt, and it has to be, because this is not a game. People die because they make mistakes, and so you can see this is a long page on metastasized cancers. It's long. What is GSM-EF facts? Everything's covered here, very clear. This is the best therapy on the planet, followed by GSM-EF. I call it the silver bullet. This, as long as it's not a small cell cancer, this can get rid of cancers very, very fast. The quicker you get here. So if you've got pancreatic cancer, some people are lucky. You fall into two categories depending on when you discovered it. If it's small, get here really quick. It shrinks 10% a day of the high pH therapy. If you spend a month getting here, you're probably not going to be able to fly, because pancreatic cancer just grows so aggressively and so quickly, and it's like this is just my hearing and explanation of pancreas cancer from specialists. Is it's similar to a pimple. It gets to a certain size and it bursts, and the pus goes out inside your body and instantly grows little tumors everywhere. And once that happens, your days are numbered. So speed of decision. My last couple of videos have been about, making a decision and making a choice and moving with the utmost speed. Talking to us, talking to whoever you choose to go to, yes? Whoever you decide is going to be the best coach for you, that you can trust and that you can work with. Get on their program. So with us, if we book you in for 3 weeks' time, within 3 days you'll have all the products in your house, and you'll start at home doing things orally. Finalize the things you need to finalize before you fly. Get your things in order. If the unexpected happens and you don't make it, you need to have your things in order. That doesn't matter who you are; they always should be in order. And then let's ding ding, round one. Let's fight this thing. Let's fight it with every possible thing that we can to get rid of it, so that you can get well quickly. Your choices are spending 2 or 3 years fighting cancer, or 2 or 3 months. In 2 or 3 months, if alternative is the path for you, because it's gone or it's not. Or if it's almost gone, you can spend another month or so to get rid of it. Slow growing cancers take longer. Fast growing cancers go very quickly. And to hit it with everything you can in one program gives you the best possible outcome you can have. And that's what you're after. That's what everyone's after. That's what we're after. We want successes. And part of our evaluating is to say, okay, I don't think I can help you. I think you've left it too late, and sadly, I'm not playing God when I do that. I just know from experience that you're not well enough to travel. The therapies may work if you happen to be here, but you're not well enough to travel. So we reject more people than out of the people that apply. Only a few manage to be successfully get through the gates, because it's difficult if you're just not, you've left things too late. And so those that choose to move fast usually have the best outcomes, but we're dealing with cancer. It's a fire, and sometimes the fire brigade manages to put it out, sometimes they don't. You can remove the bullet from somebody and they still pass away. But we're in this industry because we've seen amazing things. We've seen results on people. Rita Irvine, my longest living client, I'm sure she's not alive now because she'd be 100. But if she is, God bless her soul. And if she isn't, God bless her soul. And she was amazing. We didn't see her for 6 months after she started the program. We made an assumption that she didn't make it because when she arrived, she was almost what you'd call dead on arrival. She was very, very weak after chemo radiation and her breast being removed. And she started our program, followed everything as perfectly, went to the doctors that we recommended. At that time, we didn't have a clinic. And she became cancer-free and waited till 6 months after she got the results to come to we used to have a banquet once a year for all of our survivors and our new clients to share their stories. And she wanted to show up at that, but she wanted to show up after another 6 months and a second confirmation. And it was a very, very special moment. It was dear to me and dear to her to share her story. And she inspired a lot of others and helped others become cancer-free. And we want you to be the next testimonial. So until we catch up, God bless. Have a great week. This is Saturday, Sunday, the first day of the week. Enjoy your week. Have a good time. Do your homework. Look at the last 3 videos I've done in the last 3 days, and then find the ones that are recent. Go to the video list, and they're numbered 1 to 5. Very important. If you do that before you call me, you're going to know the right questions to ask, because ignorance is okay. Ignorance is good in some cases, but in this case, you need to know what questions to ask. Yes, if you're going to buy a new car, has it got 4 wheels? Is it electric? Is it petrol? Is it V8? You need to know the right questions. What is a car? Well, you're wanting to learn about alternative therapies. You want to know if I can help you. Try to ask the right questions. And I'll give you the right answers to everything that you ask. Until we catch up, until you get on the phone and ring me, till you fill in the form, be safe, be strong, be determined, and I'll help you get a gold medal. Bye for now. What is today? Today is the Saturday the 29th, and Yolanda's been here for, this is the 3rd week, yes?
Yeah.
3 weeks of actual treatment. 3 days and then 4 days off, and then 2 weeks every day an IV, yes?
Yeah, that was fun.
And every 3 days injections in all the areas where she has some challenges, which is all the way down the spine and in the hip. Mm-hmm. And she arrived and the pain was, I think you said 100 out of 10.
Yeah,
Was a little bit bad, yes?
It was really bad, yeah.
And how things changed? Tell us.
Yeah, it's way better now. It's
What?
almost, I wouldn't say that it's pain. If
No
you
pain.
compare with that, but yeah, that was still.
And you're also on pain, a lot of pain medicine in the beginning. Now you only
Yeah.
have one pain medicine
A
going
day.
to bed,
Yeah,
so
yeah.
that's good. The other thing, I was excited when you told me that you, everyone said you're going to dance, but you said you feel like your spine's free.
Yeah, it's free now. Yeah, I can move. Before I didn't feel it, like half of my back I didn't feel at all.
And it sort of
It was
moved
heavy.
solid together, was
Yeah,
was
and
stuck
it was
together.
like
But
really heavy.
presumably, like the cancer's joint or inflammation, whatever is joined her spine together. What I observed from the outside, and we have some images which we'll put below for you to look at, it was similar to like I'm trying to think of the right word, similar to you'll have to cut this little bit out because I can't think of what I'm trying to say. Similar to a dinosaur, lump sticking along the spine. So every vertebrae had a little lump, like a bump there. And in 2 days we noticed some of them disappear. And in 3 days, at the end of the full week, we noticed some major changes, and now they're all, you can see the screws in 2 or 3 of them, but you can't see a round lump over them anymore. So the good news is we don't really know if that's the cancer disappearing, but what we know is you're certainly feeling good.
Yeah, and at night too, before I was always wet, I would wake up in the morning, like, sweat.
Sweating?
And now I don't.
None of that problem?
No.
Eating good?
Yeah, too much.
Too much, yeah. Well, we have a problem with the food, and that is
It's too much food.
you like the food and you're getting
Yeah,
too
and
much.
I love it.
And Yolanda's put on
1 kilo already.
1 kilo in 2 weeks. So
Yeah.
it is.
Can you imagine?
The high pH used to have some challenges of people not being able to eat and losing weight, but we've refined it over the last 10 years, especially the last 4 or 5 years. I got the formula. I often you hear me talking about 20 minerals, but there's closer to 30 something minerals. And the good news is the formula doesn't affect her anymore. So she's doing really well. We're excited. This is the first stage ended, and we have another week off, and then 2 weeks, week off, 2 weeks. So we're going to do a video with the progress as time goes on. So thank you for tuning in. Thank you, Yolanda, for sharing your story with us. And we'll take a couple of photos and update people every week. So bye for now. What are they talking about? Do you think that's real? I hope you're enjoying what you're watching. Sorry to interrupt you. This is only going to take a minute. We're doing a series of 10 videos for women with breast cancer and ovarian cancer. We recently had a young lady with ovarian cancer, and well, she didn't want to do a biopsy, so I can't say it was ovarian cancer. She did not want to do a biopsy. She's scared of the medical system, and I relate to that. You all know I relate to that. So what we've done is we've done only cancer therapies, very powerful ones, and in just under 2 months, the cyst, which was large, was scanned, was obvious, and the pain was unbelievable. If I failed after she had been to 6 other medical practitioners, if I failed, this lady was thinking of checking out. It was so intense and bad, and I felt for her. And I said, listen, let's just pretend it's cancer, which in the end it obviously was, because it responded the way we have seen other tumors respond. It completely disappeared in the 2 months. And she's only in her 30s, and early 30s, very young lady, and she's got her whole life ahead of her. And, having children is an option now, and it may not have been if she went down the chemo and radiation and surgery path. So God bless the decisions she made and we made, and we got a good outcome. We'd like to get the same outcome with you. We're averaging amazing results, and I can't guarantee 100%, but in the last 5 years, we have had the best outcomes we've ever had, especially with metastasized cancer to the bone. And if you get here early with a primary, of course, it's easier. But if you at late and they've told you there is no hope, that may not be true. That may not be true. And it's up to you to choose whether it's worth a try and whether you'd like to give it a go. But we will spend 30 minutes to an hour in 2 or 3 consultations for you to evaluate us, for me to answer honestly whether I think I can help you, and for you to choose to come here or do a home program, or just learn and do some things yourself at home to possibly extend and help your quality of life. God bless. Bye for now, and register below. You need to click the link that's in the writing below this video, and that will take you to a page to register if you'd like to see those series. It's not going to be advertised anywhere else. This is your chance to register. Once we get a certain number, we will start doing the recordings, and we expect to start within the next 10 days, because there will be hundreds of people come along. There will be important questions asked that you don't think of at the moment. There's no such thing as a silly question. So register, click the link below, like this video, and share it with your friend, because they're not going to hear about it on television, are they? Until then, bye for now.
Las semanas de oxígeno hiperbárico pueden ser beneficiosas por las siguientes razones. Ayuda en la recuperación de cirugías, accidentes, fracturas de huesos, cirugía plástica y mucho más. Además incluimos pulso magnético, masajes, así como departamentos privados. Las terapias intravenosas están diseñadas para ti después de un examen médico completo. Incluimos análisis de sangre, ecografías y tomografías computarizadas en su evaluación. De hecho, las terapias IV incluirán GCMAF, vitamina C y un mix de nuestras 101 mezclas para tu propio caso. Beneficios incluidos: mejora la circulación, digestión, memoria, patrones de sueño, ayuda con el antienvejecimiento, piel. Además ayuda reduciendo dolores y molestias en los pies, aumenta la energía y mucho más. No te demores y reserva hoy tus 2 semanas de vacaciones que recargarán tu cuerpo. La oferta extraordinaria se puede reservar en cualquier momento dentro de los 90 días y tenemos Wi-Fi de calidad y puedes mantenerte en contacto con la familia y el trabajo mientras se realizan los tratamientos intravenosos.
GCMF se utiliza para la activación de su propio macrófago. Está elaborado a partir de calostro, leche materna. GC es el nombre de la proteína y MAF significa factor activador de macrófagos. Los macrófagos están en la sangre, flotan y absorben todas las células malas y defectuosas que encuentran. También limpian los tejidos dañados y no saludables. ¿Ves evidencia en ellos cuando te lastimas o tienes un resfriado porque los eliminas por la nariz? El color amarillento es el macrófago que se está limpiando en esa área. Nuestros cuerpos son increíbles, ¿no es así? Muchas cosas afectan la producción de estos amigos naturales en la sangre. La cirugía, el cáncer, los accidentes, los parásitos y virus, todas las enfermedades por nombrar algunas, pueden afectar tu cuerpo y hacer que los niveles bajen mucho. Tenemos programas cortos de 14 días para estimular el sistema inmunológico de tu cuerpo. Para más información sobre cómo mejorar las defensas de tu sistema inmunológico, visita Atlantis Health ReTreat, ofertas especiales.